Okay, thank you very much, Sarah, for giving me the floor. Um, our distinguished panelists, dear participants, ladies and gentlemen, good afternoon, good morning, or good evening, depending on where you're joining us from. First of all, I would like to extend our warm greetings from Africa CDC. And I would like to say it's my pleasure and honor to welcome you to this workshop on integrating social sciences in One Health research during epidemics. During epidemics, we acknowledge the fact that the generation of robust evidence for informed response to the outbreak is quite important. And we believe that the fact that rapid responders teams are always the ones who are in the front line in epidemic investigations and response, building their capacity with different tools to be able to generate the information which is required for response is quite important. So it is in this light that this workshop was designed, focusing on rapid responders to capacitate them with the tools in social sciences that would be important in One Health approach in research during epidemics. This workshop is in line with one of the key pillars of the new public health order of Africa CDC, which is that of capacity building. And with our database of over 900 rapid responders, we think that to keep them engaged, it's through processes of continuous capacity building. And this particular session is a third of a series with many more to come. So on this, I would like to thank our panelists who have accepted to be available to share with us their rich experience in the field of social sciences as concerns One Health research during epidemics. I would like also to thank our partners of Chatham House, University College of London, the Global Health Network, and the Pandora Network for this collaborative work in putting together this series of workshops. This activity is also aligns with one of the key pillars of our new public health order at Africa CDC, which is that of partnership, respectful, action-oriented partnership. So I want to believe that this action of this workshop that we are putting together today and tomorrow is going to address and respond to the objectives that have been set, and the impact will be felt. So I would like at this point to welcome everyone, and I look forward to all the nice experience that will be shared during this workshop. And thank you very much for everyone who has made themselves available this afternoon. Back to you, Sarah. Thanks.
Thank you very much indeed, Elvis. So my name's Sarah Edwards. I'm Professor of Bioethics at University College London. And I'm very pleased indeed to be able to bring so many wonderful colleagues together for this event. Now, you'll all recognise the importance of using social sciences during outbreak responses, otherwise you wouldn't have signed up for this event. But it's worth just stressing that there's a multitude of opportunities in the social sciences that could help us be better informed about our responses to outbreaks. Looking now at the objectives we listed for this event, it does look rather eye-watering, but I think that we can probably cover them all. So Elvis was talking about capacity building, which is, a particularly important element. But we're also wanting to raise awareness of what sorts of different social science disciplines might be able to offer important insights in this area. So not only improving skills and knowledge, but also consulting for policy making at the African CDC and elsewhere. by identifying gaps in current provision, looking at what the social issues are of first responders when you encounter outbreaks in the field, and what you do with that experience and that knowledge. So we're hoping to also help recognise when and from whom you seek existing knowledge on social sciences once you've encountered different issues, and to help determine with your officials and the African CDC when primary research in the social sciences might be needed, particularly when we're talking about fields like anthropology. There are many different disciplines, as we'll learn about over the next 2 days, but we're wanting really to help to integrate a collaborative exercise in the social sciences, which isn't always easy, as we'll again discuss later on. In so doing, for the African CDC in particular, to really consolidate and share the collective expertise that we've clearly seen across the continent. So to do all of those things, we've got then 2 3-hour sessions over the next 2 days. And the sorts of activities we've got in line for you include short presentations, so you get to know, what the current provision looks like, what opportunities there are, and what sorts of paths have been trodden already in this area. Not only presentations, though. I mean, we've all seen death by PowerPoint, but we're going to be engaging in plenty of discussions, Q&A, case studies, and this is the slightly experimental part, for us at least, is the introduction of more interactive activities. We've previously tried breakout rooms, we've tried case studies with everyone involved from the start as a cohort, but this time we're going to be using a platform called Mentimeter for some of the interactive activities, which should be very easy to use. We would like to hear, though, in the chat if you do have a problem with it. If you're able to link on Zoom to get access to this meeting, you should too be able to use the link to Mentimeter automatically, that will appear in the chat at the appropriate moments. You shouldn't need to download anything or need extra bandwidth in order to engage in these exercises. So this workshop and the interactive activities, the consultative efforts, they all form part of a greater effort that will be following up to gain greater knowledge from you about what you see the issues with the social sciences as being, and what barriers you see there to integrating these different ideas in the field. So we'll be both offering participation in a virtual discussion forum that was set up following the research ethics workshop we held relatively recently. That can be a forum that we use for having live Q&As, sharing experiences, and crucially, I think, to be able to perform quick consultative surveys and interactive activities that aren't captured necessarily only through this workshop. We will be following up with more live events such as this, but we want to be able to sustain the momentum and interest, and indeed the research in this area. We're learning as policymakers quite how to do this, and an integrated model is really something quite new. So here is the agenda for today. The other bits of housekeeping, it would be very remiss of me not to mention, would be the fact that the workshop is being recorded. Your videos and microphones have been disabled for now, hence the need for the link to Mentimeter at the appropriate times. Please do use the chat box as it's saying on the slide, and the Q&A box for questions. If you wish to have a certificate of attendance, and that's very important for your CV and for your capacity building records, you need to attend at least 80% of the workshop and complete the evaluation, which will be sent out after the workshop via the Global Health Network. And then your certificate will automatically arrive in your inbox. And again, questions, get in quickly if you have specific questions, post them please in the Q&A box, and we'll do our level best to address them and answer them, if not in real time, then at some point over the next 2 days. So I'm very pleased now to hand over to our chair, my colleague of long standing and very good friend, blessing, Selewaga. Thank you very much indeed for joining us. I know that you've got a very busy schedule as Senior Research Ethics Manager at University of Cape Town. Blessing has been doing a lot of work with us in the Pandora network, particularly on the research ethics framework that you'll no doubt have heard about already, and will no doubt be hearing more about in due course as we engage in future consultative exercises. But for now, I'll hand over to you, Blessing, and please go ahead and share our speakers for the first session, the scene setting session, I like to call it. Thank you.